Hi, I'm Chandler from Aspen University. In this video, I will be discussing syndrome of inappropriate antidiuretic hormone release. This disorder is the result of excessive secretion of ADH from the pituitary gland. To begin with the pathophysiology process of this disease, we know that the pituitary gland, secretes excessive antidiuretic hormone with this process. An increase in ADH increases the permeability of renal tubules. Increased permeability of the renal tubules leads to water retention and increased extracellular fluid volume. Increased extracellular fluid volume leads to a reduced plasma osmolality or concentration, dilutional hyponatremia, diminished aldosterone secretion, and elevated glomerular filtration rate. These factors lead to increased sodium excretion and a shifting of fluid into the cells. The signs and symptoms that we may see with syndrome of inappropriate antidiuretic hormone release include weight gain due to the water retention, increased fluid volume. They may be lethargic with sluggish deep tendon reflexes, as well as emotional and behavioral changes. We must recognize that the first sign of increased intracranial pressure is confusion and a change in consciousness, so we will need to frequently assess their neurological status. Other clinical manifestations include tachycardia and disorientation to place and time. The causes of inappropriate antidiuretic hormone release may be cancer. There may be a tumor on the pituitary gland that is prompting excessive release of ADH. A head injury or a cerebrovascular disease may also be associated with this disorder. There are medications and interventions as a nurse that we may implement, such as fluid restrictions, high salt, increasing the protein in the diet, and most importantly, correction of the underlying cause of the disorder. There's a medication, democycline, which blocks renal response to ADH. Again, we need to frequently assess the neurological status and elevate the head of the bed to prevent cerebral edema, at least to 30 degrees. We should initiate seizure precautions and watch for signs and symptoms of heart failure. Other complications of this disorder include electrolyte balances, such as hyponatremia, arrhythmias, seizures, hallucinations, coma, and death in severe cases. Thank you.